An explanation of the gastric bypass surgery and the need for protein. The gastric bypass surgery is a weight loss surgery that is accomplished in two ways, either by laparoscopic technique or open surgery. Usually done under general anesthesia, the laparoscopic surgery involves several tiny slits in the abdomen. After filling the abdominal area with gas, the doctor will insert instruments into some of these slits, and in another, there will be a light and a camera that allows the doctor to see what he is doing. He will manipulate the instruments through these small slits and complete the procedure, after which the gas will be removed from the abdominal cavity. Residual gas will be eliminated from the body after you are up and about, but it can cause pain or pressure until it all comes out. In some cases, the surgery cannot be completed laparoscopically and must be completed by open procedure instead. An open surgery results in a much larger, traditional incision and a longer recovery period. In either case, the stomach is divided into two sections, an upper section and a lower one. The stomach that is no longer being used will remain inside of the body, as will some of the intestine that will also be closed off. The upper section of the small intestine will be closed off, meaning that any of the nutrients that are commonly absorbed there will continue through the system. The success rate of the gastric bypass surgery. There are other types of weight loss surgery, including restricted procedures that involve the use of gastric banding. These types of surgery involve the use of behavioral modification to accomplish the task of weight loss, a system that relies on the patient, who may or may not be able to comply with the new rules that are set for them. The gastric bypass allows most patients to lose about 60% of their excess weight, and over one-third of them will lose over 80% of their weight. As many as 90% will have kept off most of their weight 10 years later. Most patients will have reached their lowest weight around 2 years after their surgery. Drawbacks to gastric bypass surgery. There are several drawbacks to gastric bypass surgery, however. First, it is not reversible. Second, because it changes the rate and the way that your body absorbs and uses nutrients, it can increase the risk of malnutrition, especially for certain nutrients such as protein and calcium. It also increases the risk of dumping syndrome, which occurs when food moves too quickly through the system. This can lead to feelings of nausea, cold sweats and chills, severe diarrhea and chest pains. It is important that you understand how serious dumping syndrome is, especially after gastric bypass surgery, because you have less nutrients being absorbed. You run a higher risk of dehydration if you have diarrhea that lasts for an extended period of time. Post-surgery considerations. After your surgery is completed, you will need to follow all of the guidelines that are set for you, because if you do not, your stomach pouch will expand and become stretched out. In addition to causing pain, you may again gain weight this way, especially if you did nothing to change your behavior following the surgery. There are some patients who rely purely on the surgery to lose weight and will continue to make poor food choices despite all of the warnings that they are given. Nutritional needs. The amount of food that you will be eating after your gastric bypass surgery will change, and so will the amount of nutrients that you need. For instance, you will need increased amounts of protein, especially immediately after your surgery is completed. Protein is important because it speeds your healing time, helps to prevent infection, which can be dangerous after any kind of surgery, and also helps to create and protect your muscle mass as you lose weight. Without enough protein, you will have problems, including dry hair and skin, brittle nails and more serious problems, which can include irregular heartbeat and even death. Protein plays a role in the production of hormones, enzymes and the functions that they are used in. It is also important to keep hunger at bay and to help increase the metabolism. There are other nutritional needs to keep in mind as well, which your doctor will discuss with you thoroughly. You will need to use supplements for many of the vitamins that you need on a daily basis, as well as others, which may include calcium, iron and protein. The amount of each nutrient that you need will be determined by your status before your surgery and your individual needs. Protein supplements. There are a number of protein supplements that you should consider. At first, you will be instructed to stick with liquid foods and supplements, which will limit the types that you can choose. Protein shakes are a good choice, but they may be too high in calories for some people to use. Another option is ProfectR, a liquid protein supplement from Protica. It is a small liquid shot which only takes seconds to consume but gives 25 grams of protein per each serving in only 100 calories. As you recover from your surgery and move into eating other types of foods, you will have an expanded array of protein supplements to choose from, including bars and pudding shots. It is important to continually check the labels so that you are making the best choice for your needs. Some of the protein supplements are filled with too much sugar, which can make them a poor choice for weight loss, especially if the sugar is displacing other, more important nutrients in the diet. Too much sugar can also slow the rate of healing after the surgery. Gastric bypass surgery, a case study. Dion has been overweight for all of her life. She has tried several kinds of diets, but has always failed. Convinced that she would always be big, she allowed herself to eat whatever she wanted, gaining even more weight. Following a scare with her heart, her doctor sent her to a bariatric specialist who recommended that she have gastric bypass surgery right away. After her surgery, Dion had to start using supplements for many of the nutrients that she was not getting from her small amounts of foods. It was also her choice to seek out behavioral support programs to help change her attitudes toward food and her own health. In addition to these changes, Dion is adding ProfectR to her diet several times a day so that she is getting enough protein in her diet. She's also going to look for ways to exercise, knowing that she will have to start small and work her way up as she loses weight. As her body changes, she will need to adjust the types and amounts of foods that she eats. The less she weighs, the less that she will need to eat. However, as she builds lean muscle mass, her metabolism will increase and she may need slightly more food to keep her energy up.